is November 19th. This is the second day that we will be hearing from our boards and commissions. I just want to make a couple of opening comments before going through a little bit of the logistics here. And that is first to begin by thanking all of the members of the boards and commissions for your dedication and service, particularly now. The council continues to receive very challenging briefings on the immense and growing need within our community. Over 180,000 county residents have filed for unemployment. There are hundreds of county residents that are already in the queue to face eviction. And there is so much need across every sector of our social safety net across the board. And so I want to express my thanks and appreciation to my colleagues in the Department of Health and Human Services, and in particular, Dr. Crowell for his leadership throughout this unbelievably trying and challenging time. We have Dr. Santiago, who is representing HHS today on this session, and there will likely be other members of the HHS team that will be here to observe and listen as the boards and commissions provide their testimony. We're going to try to do what we did yesterday, which is we're going to have three boards and commissions come up together as they would from the dais if we were meeting in person, and we will ask that each board or commission limit their testimony to between 5 and 10 minutes. And after each of the three respective boards and commissions speak, Councilmember Glass and I, and Councilmember Craig Rice, if he's able to join us, will then ask questions of those three boards and commissions. The boards and commissions that are not speaking, we ask that you turn off your camera, and the same for HHS staff as well, as you guys are here to observe. And if there are questions that arise during the Q&A that cross over into HHS and the team, or you'd like to weigh in, please feel free to do so during the Q&A component. And so the last thing I'll mention, and as I mentioned yesterday, this is one of my favorite days on the HHS committee because it does really give you a much deeper appreciation and understanding of the challenges that each of you are trying to tackle within your respective boards and commissions. And it also provides a stark view that helps us acknowledge that all these issues are connected in some form or fashion, directly or indirectly. And so this is a very, very valuable exercise. And as I said yesterday, some of the testimony I heard last year directly influenced legislation that I moved forward, and certainly influences the budget planning process as well. So with that, I'll turn it over to my colleague and friend, Councilmember Glass, who is our lead on homeless and vulnerable populations and has been doing an outstanding job in that space and so many others. Councilmember Glass.
Well, thank you very much, Chair Albornoz, and good morning, everybody. Thank you for joining us bright and early this Thursday. And Chair Albornoz has teed it up beautifully that, we really appreciate all the work that you have been doing over this last year, knowing and recognizing that it's been a little different and it's been very difficult. And it has centered us and focused us on the work that we need to continue doing, because everybody here is focused on making sure that our social safety net is as strong as possible. And the health and economic crises that we have been living in over the last 8 or 9 months has stressed it and strained it, and has made us all the more cognizant of where the gaps are, which is why these conversations over the last number of months and the ones that we're having today and yesterday will help us figure out how to provide services for everybody who needs them. And whether it results in legislation like Chair Albornoz said, or in budgetary allocations moving forward, these are really important conversations to inform us, and appreciate all of you being here this morning.
Terrific. So we are going to get started. Ms. Yao, correct me if I'm wrong. Want to make sure I have this right, but there was one commission that was not able to speak yesterday, and that was the Commission on Childcare. Is that correct?
Sorry, that's correct.
Okay. And were we able to connect with representatives from the Commission on Child Care? Do we know if they're going to be joining us today?
I do not believe that they are able to join us today.
Okay, so then we will go by the list as represented in alphabetical order or in order that it's presented on the sheet within the packet. And so the first three commissions or boards that we will hear from this morning are first, the Victim Services Advisory Board and Ms. Catherine Ponser. Second is the Montgomery Cares Advisory Board and Mr. Wayne Swan. And third is the Mental Health Advisory Committee, Garrett Manchin. So everybody else who's not a member of those boards or commissions, if you could turn your camera off and your audio off for now, and we'll bring you back on when it is the appropriate time. And once again, we ask that each of you limit your testimony to between 5 and 10 minutes, and we will ask the panel questions upon the completion of all three boards. So Ms. Ponser, from our Victim Services Advisory Board, the floor is yours.
Good morning. Thank you, Chair Albornoz, Councilmember Glass, and Councilmember Rice when you listen to this video. My name is Catherine Ponser. I co-chair the Victim Services Advisory Board along with my colleague, Juanita Rogers. I want to thank you for holding this policy session to hear from all the stakeholders together. I think that's really an important discussion. I also want to thank Councilmember Glass for initiating the recent proclamation recognizing the board's work. We really appreciate it. As you know, our board is concerned with the needs of crime victims. One priority that we've met with many of you on, and many of your offices and your staff, is the need for both one-year bridge housing with case management services, as well as improved access to permanent housing for victims of domestic violence and their families. I address this in more detail in my written testimony. I would like to focus my few minutes on the impact of the pandemic on victims of crimes and on victim services provided by the Victim Assistance and Sexual Assault Program, or VASAP, and the Abused Persons Program, APP. Both of these programs are part of HHS's Behavioral Health and Crisis Services Division. The impact of the pandemic on these programs is concerning. The demand for help from victims has almost doubled in the past year. Specifically, with data that we've looked at with staff, we see a 91% increase looking at the data from last year to this year between January and June of both years. But the board suspects that this percentage difference in demand has grown since June, with individuals and families experiencing continued challenges from COVID. The staff report that the severity of the cases have become more critical, with an increase in domestic violence, sexual violence, and more reports of strangulations. Additionally, more families of homicide victims are seeking help. Crime victims in the county have faced two obstacles because of COVID: the fear of accessing services and becoming infected, and the temporary closure of services. For example, the number of victims seeking help for sexual assault injuries at Shady Grove Medical Center is down, as well as the number of victims of domestic violence seeking shelter at the Betty Ann Cranky Shelter. Staff have been working to get information to victims that these services are safe. Safe Passages has reopened for supervised visitation on the premises and never closed for supervised exchanges. While they were closed for supervised visitation on the premises, the staff heard from many parents who were very frustrated and angry and sad that they couldn't see their children. Victim assistants who work in district court with peace protective orders and in circuit court with criminal and family law cases have been working remotely to prepare victims for court and doing safety planning remotely. Excuse me. There's a waiting list of over 150 domestic violence offenders who are required to participate in the mandated offenders program. And this staff feedback in terms of the situation tracks very closely to Montgomery County Police press reports. The police report that the homicide rate is up 167% compared to the same time last year. There's a 10% increase in rapes and more cases in hospitals involving child abuse. While calls to police for domestic violence are down, the police indicate that it may be more difficult for victims to call for help as they're locked down with their abuser. For those cases that have been investigated, the police are concerned with the increase in violence. Ironically, enhancing staffing levels and resources for both of these programs has been a priority for our board for the past few years because these programs lost staff back in 2012. And I know of 3 staff that were lost in 2012 and transferred to other programs. There may be more, even more recently. But now, with the anticipated budget cuts throughout HHS and with a lot of COVID relief spending, the board requests that you address the escalation in severity in victim crimes by at least maintaining the resources for both of these programs. Thank you.
Thank you, Ms. Ponser. That is sobering but very important testimony. Next, we will be hearing from Mr. Wayne Swan from the Montgomery Cares Advisory Board. Oh, and I apologize, Mr. Swan, really quick. Councilmember Rice has joined us. He is got his video off because it is 6:40 in the morning where he is. So we appreciate his participation. And it goes without saying, both Councilmember Glass and Rice, if you'd like to speak, just shoot me a text message. And once again, we will be asking questions after all 3 presentations. Mr. Swan. And you are on mute.
Okay, is that better?
Yes, we can hear you. Thanks.
Wonderful, thank you. Okay, again, good morning, Chairman Albornoz and committee members Rice and Glass, and Dr. Kroll. The Montgomery Cares Advisory Board provides advice and guidance to the county executive and the county council, which financially and operationally support the healthcare safety net for uninsured, low-income residents of Montgomery County. In fiscal year 2020, the MCAB focused on programmatic gaps, budgetary concerns, and monitoring the current COVID-19 pandemic effect in care. The MCAB continues to focus on its mission, covering programs of the healthcare for the uninsured, including care for kids, maternity partnership, dental services, healthcare for the homeless, as well as Montgomery Cares program providing direct primary care. We are in a time of healthcare transformation where activities focus on improvements in coordinated and continuity of care. The Montgomery Cares Advisory Board has identified specific priorities for each program. However, the following are the overarching goals that will guide the board in FY21. The first is reducing and eliminating barriers to access care given COVID-19. This has become increasingly important as residents are facing challenges with eligibility, attending appointments, and managing visits for telehealth and telemedicine. Additionally, the political climate is affecting our most vulnerable residents from seeking and obtaining necessary health care. Related to this, MCAB has been closely monitoring program utilization and data within the programs. A few of the Montgomery Cares clinics have become COVID testing sites for all county residents and face workforce issues with clinic staff out due to the pandemic. Additionally, the MCAB continues its focus on ensuring that core primary care services meet patient demand while expanding other services such as specialty care, immunizations, and COVID-19 and flu testing for this vulnerable population. The second overarching goal is identifying synergies and improving quality. The MCAB is emphasizing the need to have data and performance measures that show the effectiveness of the programs. This year, MCAB is focused on 3 areas: quality assurance data for care for kids, maternity partnership, and Montgomery Cares. These reviews will focus on process and outcomes associated with the delivery of healthcare and utilize appropriate and accurate measurements to monitor quality, cost, and patient outcomes, including patient satisfaction, in support of population health. MCAB plans to implement these priorities with a mindset toward prevention. By effective interventions and strategies delivered with an array of settings, we can introduce messages and programs aimed at preventing or delaying access to care. We would like to thank the Council, the County Executive, the Department of Health and Human Services, and our partners for their continued support. Thank you.
Thank you, Mr. Swan, very much. We will ask questions in a little bit, but Mr. Garrett Manchin, you may begin from our Mental Health Advisory Committee.
Thank you, Chairman Albornoz, Council Members Glass and Rice, and Chief Santiago for inviting me to testify this morning on behalf of the county's Mental Health Advisory Committee. I'll keep my comments brief and ask that you refer to my written testimony for more discussion of each of our priorities. As you know, the Mental Health Advisory Committee is composed of county officials, mental health providers, and people who have received mental health services in the county and their family members. We adopted our priorities for the upcoming fiscal year at our November meeting a few weeks ago. Those priorities, we've identified 3 priorities for this year. First, respond to the county's rising suicide rate. Second, improve the county's crisis response system. And third, address the environmental impacts on mental health and county residents' resilience. Now, on the first point, in recent years, suicide rates have increased nationally, especially among the youth, and this trend has become further exacerbated by the COVID-19 pandemic, which has caused significant disruption to residents' daily lives, jobs, financial stability, and social networks. We've identified the following steps that the county should take to address this growing problem. Increase funding for Every Mind's hotline so that it can add text and chat between 12 a.m. and 8 a.m. and follow-up calls for children who receive crisis services. Pass legislation to add mental health education at the elementary, middle, and high school levels. Add additional support for counselors after school-based mental health presentations. This will support the increased trend of student reporting to school counselors after mental health presentations, which in turn results in counselors requesting assistance from mobile crisis teams. Hire DBT specialized providers for the county's mental health clinics and require non-county clinics to staff such providers, or alternatively, identify incentives to attract more DBT specialized providers to work in the county. On our second priority, this has been a year of ups and downs for the crisis response system. First, I'd like to thank the council members for your work passing the special appropriation this year to add $592,000 to expand the capacity for the mobile crisis team, which, as you know, could use additional increased capacity. Despite these gains, we need additional resources and authority to adopt policy changes to ensure appropriate mental health services are available for residents experiencing an acute mental health crisis. And on the downside, we did not receive the requested funding from the HSCRC to implement the Crisis Now model, which would have transformed the county's mobile crisis system by creating a county restoration center, expanded the capacities of the county's crisis hotline, and restructured the mobile crisis teams to include a peer counselor. We've not yet learned the status of another grant proposal seeking funding from the Maryland Department of Health's Behavioral Health Administration, which is submitted in June. Regardless, we strongly urge the County Council and County Executive to prioritize the increased funding to BHCS to drastically expand the county's crisis services. By doing so, the county would ensure that individuals suffering from mental illness receive appropriate services and allow us to move away from putting the burden on fire and rescue and, more frequently, to the police to intervene. Expanding crisis services in this way would promote increased trust from the community, and by taking the burden from police departments, it would be an important first step in restoring trust between police and communities they serve. This would also reduce costs to the county by reducing unnecessary emergency room visits, 911 calls, and diverting individuals away from jails, prisons, and the court system. Moreover, it would promote a healthier Montgomery County and help individuals stay in the workforce, all of which would improve the county's economy. Finally, we request the County Council to address the environmental impacts on mental health and resilience. As the ongoing pandemic has made clear, continued access to quality health services during the state of emergency is critically important. Yet ensuring access to these services during the state of emergency requires substantial planning and resources, and the growing threat of climate change is likely to present its own unique challenges to ensure county residents have access to mental health services. Accordingly, we recommend the county take steps to include a mental health component to its plans to address climate change. In particular, we recommend focusing on these priority areas. First, recommending the inclusion of mental health representative on the ECARP and Department of Environmental Protection Work Group and other related meetings to report back to our committee, ensuring mental health services are adequately represented in county climate change plans. Second, recommend that the county expand the health frame to include mental health and request the development of research-based recommendations related to crisis situations and ways to build community resilience before, during, and after crisis events as part of our preparedness efforts. Thank you.
Thank you very much, Mr. Manchin. And so I have a few questions and comments of all three commissions. I'll start with the Ms. Ponser and our Victim Services Advisory Board. Again, truly sobering testimony. It tracks with what we have been hearing from HHS and our nonprofit organizations that do work in this space, the Family Justice Center and others. One potential solution in a very complex problem is that we did launch next generation 911 technology earlier this year. And so you can now text to 911, and there has been an effort to educate the public about that option. But I think we need to double down on that. I think there's an opportunity for us to let folks know that that service is now live and available, and one that I think certainly won't prevent some of these tragedies from happening, and the underlying issues, in some cases related to mental health and stress and the economic stress and everything that families are feeling right now, and not being able to leave their homes and not having as many touch points for organizations that can serve as intermediaries is all compounding the problem. But I think that that's something I'd like to look into. So Ms. Yao, as a follow-up, would like to, this is a crossover to my hat in the Public Safety Committee, but I know there was an effort afoot with some communications funding to expand the promotion of the next gen 911 technology. And I think we need to, if we aren't already, be more intentional about working with victim services groups to let them know about that technology. And then with regards to children, again, tracks with all that we've heard so far. And of course, it's often teachers that are the ones that make referrals, when there are victims of violence. And of course, because of distance learning right now, which we have to unfortunately move forward, it's just sort of an ongoing challenge. We did have a discussion about this, and I know MCPS has tried to take steps proactively to address the needs of families. I see my colleague and friend, Councilmember Craig Rice, who's the chair of our Education and Culture Advisory Board, who does an amazing job chairing that board, probably has some thoughts on this too. But I think that that's an area that we probably need to focus on even more than we already are. And so I think that's something that we should follow up on, and clearly something that is a concern of all of us. With regards to the Montgomery Cares Advisory Board, well, actually, let me stop there. Ms. Ponser, has the commission discussed the 911 technology and the next gen technology? Has that been, sort of a discussion point? And do you think that's an opportunity for us to be able to promote? And do you think in some way that might provide some help?
First of all, Chairman, can you hear me?
Yes, we can.
For some reason, I've lost my camera to see all of you, so I just want to make sure you could hear me.
We can hear and see you.
Okay, thank you. I absolutely believe that this is not something that we've discussed as a board, but it really falls right in line with a lot of what our concern has been, that we continue to have more than one, enough access for families to reach out for help and assistance. As opposed to going backwards and having less access and consolidating. We've been concerned about not having enough access. So we will certainly look into that. And I can't see why it isn't something that we can continue to support and advocate for as well, and see who the stakeholders are that we need to work with more. And I'll follow up with Vivian, and we can figure out who it is we need to touch base with to talk more about it.
Great. I appreciate that. Mr. Swan, just really quickly, we are going to have an HHS committee session in January when we get back from the holiday recess and specifically to talk about the Affordable Care Act. Now that it does look like there will be a transition to a new administration, obviously, I think it's also an opportunity. As I've started to look at the list of people who have been appointed to the Biden transition team, and I have friends who are starting to get calls from that transition team, I think there's an opportunity for us to have our voice heard and work with our federal delegation, because President-elect Biden has made clear that this is a priority of his administration in strengthening the Affordable Care Act. And I think that session will be timely to see how we may be able to leverage those relationships, leverage this hopeful new energy to amplify and provide further support for our work here in the county. And so I think it would be great to have you guys participate in that work session. And related to that, sometime in the upcoming year, probably the spring, I was hoping for the winter, but there's just too much going on right now. We are going to have a public health summit to take into account the lessons learned, to do a deeper dive in those health disparities that existed prior to the pandemic but have now been exacerbated because of it. And I envision you guys participating in one of the breakout sessions to help facilitate a discussion around how health insurance and the access to it, particularly for our Black and brown communities, is something that we need to double down on and focus on as well. So we will follow up with your commission specifically on that, because I think that you guys could be really helpful in facilitating a really productive discussion. And by then, we should know more information on what transition will happen with the Affordable Care Act and be able to plan accordingly here in the county. So there'll be more to come on that, but I look forward to working with you guys on it. And then I guess one question for you is, you mentioned the flu vaccine, couldn't agree more. Are you seeing in the community a reluctance to access the flu vaccine? Any feedback there, or have things been pretty much on track as consistent with previous years? Because there is a concern that there's I think, just fatigue over the virus in general, so much misinformation. Vaccines in general are painted, unfortunately, in a negative light. Is the board seeing anything in that space?
With respect to the clinics, we're really not seeing much of a difference in terms of acceptance of the flu vaccine. It will be a challenge going forward to try to get greater acceptance of a newer vaccine, given those reluctances in the past.
Gotcha. And I think it'll be good to work with the board to kind of get the word out that it's safe and something that people should be focused on. And then with regards to the Mental Health Advisory Committee, that has been the theme of every session we've heard so far in some form or fashion. And so the recommendations of the committee track well with what we are hearing from others. And so this is definitely an area of priority. We've had now 3 joint HHS and Education and Culture committee sessions just this year alone, specifically on the mental health of our children, youth, and families. We've brought a number of different stakeholders to the table, and we had what I thought was an extraordinarily productive session recently, in which we talked about the need, and we've been talking about this for a long time now, but the need to make as high a priority as we can make it, diversifying our mental health professionals so that we have more culturally appropriate, we have more language access, because we know the studies have shown conclusively that when you are working with a mental health provider that is in a better position to understand where you're coming from, it just leads to better care. And I think that's really important, and something that we're going to be following up on in another session to keep the momentum going and hopefully have that influence the budget planning process going into next year. And the mental health issues are going to expand, and there's a lot, frankly, we don't know right now. We don't know exactly how this is impacting our children and youth. We know generally, but it's not until we start to have access to them in the way we did before we really start to process the ramifications of everything that has happened. So, and then just finally, appreciate your comments regarding the mobile crisis team. We have, thanks to HHS, been able to stand up at least some portions of what we had applied for in the state grant. But there is no question that that's a model that we must not lose momentum in pursuing. And I'm hopeful that all the efforts that were underway to get that model off the ground in the first place, which created a lot of links and trust and collaboration, will continue. And we received a briefing on this, and I am confident it will, but we have to back that up with resources. And so I very much concur with all of the committee's recommendations. And Dr. Santiago, your camera, you've got something kind of covering you. I don't know if that's tie or something, but it's very distracting. I apologize. So if that I'd appreciate it. So let's go on, and I see that we've got Dr. Rice. I just promoted you there, Craig. But Councilmember Rice has questions and thoughts of the group, and then Councilmember Glass will go right after Councilmember Rice.
Well, thank you very much, Mr. Chair, and thank you to all of you this morning. I apologize. It's a little trying to get my equilibrium set for being in the Midwest right now, picking up my daughter from school. But listen, Ms. Ponser, I couldn't agree with everything more that you said. Many people don't know, but I actually served on the Victim Services Advisory Board for a number of years prior to joining the council. And the reason why I did that is because my own family, unfortunately, experienced some of the worst outcomes of domestic violence that you can see. And so my concern is one in which, especially when it comes to housing, is incredibly concerning and in the midst of COVID, right? So it's always been a concern. I know that Ms. Yao and Ms. McMillan have, worked together with me in trying to establish some more housing structured. So I'd love to talk to you more about that, because a lot of our women, and Councilmember Glass knows this all too well, being our lead for homelessness, that a lot of our women who are homeless, especially those with young children and families, are oftentimes victims of domestic violence. And that's the reason why they ended up homeless. And because they decided to escape their abuser and then didn't have the resources necessary to help continue to support them. So I'd love to follow up with you more on that. All of the other things are absolutely spot on. We see that, so I love what you said, Mr. Chair, about continuing to focus on ways in which folks can continue to report and get the support that's necessary. I know that when I recently did a Montgomery Village public safety meeting a little over a week ago, both the sheriff and state's attorney were on that Zoom and talked directly about these particular issues. And talked about how they're really laser focused on trying to do more. So again, I think that incorporating some of the recommendations that you have here and us continuing to have conversations, there are some things that we can certainly do in the future. To Mr. Swan, thank you, sir, for continuing to be that stand up for folks who are either underinsured or uninsured. People pretend as though folks still aren't uninsured because we do have the Affordable Care Act and don't realize that that's still the case. And it's incredibly important now because what's happening and what we're seeing, and so I'm curious, this is a question for you, is that when it comes to children and some of their normal vaccinations that they normally get, they haven't been getting those, which is dangerous and concerning. And so from that perspective, what can we do to give folks the confidence in coming out to their doctors to be able to still get those vaccinations for their children that need them in the midst of a global pandemic where we've got COVID all around us?
Yeah, it's an excellent question. Along with masks, I think we're seeing immunizations become kind of a political statement as well. Some people just will not support immunizations, and it just seems to be a pretty solid core of people that fall into that bailiwick. But we're trying to do as much as we can to kind of educate the parents to be able to push this forward and to increase the number of immunizations.
Well, thank you for that, Mr. Chair. I think we need to do a follow-up on that, and it could be an EC HHS joint meeting because I am incredibly concerned. I know that when I talk to my child's doctor when she went in for her immunizations, and we were just talking. They were saying that they're record lows. They've been emailing people and calling people, but still haven't been able to connect. And so I'm really concerned about some of the challenges that we may have there and how we need to create a more robust effort to try and get folks out to get those immunizations done. So just a pen in for follow-up. And then very quickly, I'm sorry for taking a long time, but Mr. Manchin, thank you, sir, for really continuing to stand up the need for mental health supports in our community. I just want to flag something, and I really want people to remember that folks have been thinking about this for a long time. The Curran Commission recommendations that came out that specifically for our students, now again, this isn't for our adults, but still for our students, have laid out some very, very extensive ways in which we can continue to promote the mental health and well-being of our students, including ensuring that we not only have a state coordinator for school behavioral health, but also at each local level from a jurisdiction perspective, that they have a behavioral health coordinator who can then work with people. And so there's money and a responsibility that's attached in Curran. And I want to read this. It says, provide appropriate funding, often supported by IDEA and other educational funds, for adequate staffing of school-employed staff, for example, school psychologists, school social workers, school counselors, occupational therapists, to support student behavioral health using recommended ratios from national guild groups. That is in the Curran Commission. And so that means that every school throughout the state of Maryland should have this. And the only reason why we haven't moved forward and getting this started is because the governor vetoed that Curran Commission bill. So anyone who cares about mental health in our children should be writing into our General Assembly. And so I really ask that MHAC and everyone do a full court press as we have the General Assembly session coming up upon us, and make sure that folks understand what some of the things are that are incorporated in this Curran Commission recommendations and how they directly affect the mental health of our children. So again, I really just want to say thank you to each and every one of you for all that you're doing. It is incredibly amazing that you continue to push in so many different directions that are so important to us in the community. And I look forward to standing by you in all of your recommendations and helping to bring those to fruition. Thank you so much, Mr. Chair.
Thank you, Councilmember Rice. That was well said. Councilmember Glass.
Thank you, Mr. Chair. I appreciate your comments and those from Councilmember Rice all the way from Colorado, bright and early. So thank you for being part of the conversation. And so, both of you have addressed most of the questions that I had written down during public conversations. But just real quickly, Ms. Ponser, I appreciate everything that you and members of the Victim Services Advisory Board continue to do. And I feel like I received a deep dive when I attended one of your recent meetings. And so I just want to again say thank you for all that work. And much of it is untold for various reasons. And the numbers, I think, as you referred to, are likely underreported these days because as we're all confined to our homes, it does not allow us the ability, or it does not allow victims the ability to escape, to tell their stories, to ask for help. And so please continue asking us for any help that we can provide you and provide victims here in Montgomery County as they continue living lives that are probably more difficult, or are more difficult than they were before. So thank you again. Mr. Swan, your emphasis and your board's emphasis on making sure that the uninsured are healthy and safe during this pandemic, having the health equity and parity component, so critically important. And want to thank again the chair, Councilmember Albornoz, and Councilmember Rice, along with Councilmember Navarro and Jawando for their efforts over the last 8 or 9 months to make sure that every community and segment of our community here in Montgomery County have the health care access that they need. Because the COVID crisis, both the health component and the economic component are hitting our Black and brown communities hardest. My 4 colleagues and friends have been doing incredible work with some of our nonprofit partners, civic organizations, and the Department of Health and Human Services to get into the communities that really need that help. And so to have you and your board members backing up and sounding those alarms that we and so many others have heard is really appreciated. So please continue doing that and letting us know what communities are feeling and what more we can do to bring that to close the healthcare gap that we know exists and has only been exacerbated. So thank you, Mr. Swan. And then, Mr. Manchin, I appreciate your testimony and sharing your thoughts, and wasn't expecting the third component of your testimony regarding environmental impacts, and I welcome it and appreciate it, and just want to share with you, not only the work that has been taking place, but that which is to come in the next few weeks. Quite frankly, it is the mental health component that we're all being. Let me rephrase it. When we're all forced in our homes, right? It causes a lot of different issues. And one of the reasons that the Parks Department and the Department of Transportation has been working towards an open streets concept is to allow people to get out of their homes and out of their apartments, not only for physical exercise, but mental exercise as well, get some fresh air, see some people. And so the Open Streets program has been working towards helping people during this time in that certain way. But with regard to the environmental impacts, I want you to know that I also serve in the Transportation and Environment Committee, and the county executives team in the next few weeks, or at least the next month or two, will be publicly sharing their environmental work group recommendations. And over the last 2 years, essentially, the executive team has convened hundreds of our residents, leading experts nationally and globally in the environmental space, to come up with a number of environmental recommendations. And when I say a number, they came up with about 800 environmental recommendations here in Montgomery County. And that is a lot to share publicly, but they have distilled them and ranked them in order, and they will be publicizing those results and the areas that we need to focus on in the coming weeks. And so given your priorities on this, my dogs agree that they are priorities. And so let's stay in touch and see what we can do, and see particularly what issues, what areas in their recommendations align with the work that you are doing. So let's definitely continue this conversation. And again, I really appreciate your focus on that area. Thank you. I yield back, Mr. Chair. Thank you.
Thank you, Councilmember Glass. One other point I forgot to mention, and this is for the Montgomery Cares Advisory Board. The state delegation right now is pushing to continue the relaxation of some of the policies around telemedicine and telehealth at the state level until legislation is passed to make them permanent. Because I think telemedicine and telehealth in the mental health space and in so many other spaces presents some really unique opportunities for us to help close some of those health disparities. So I encourage the board to look into that and maybe even consider writing a letter of support. And the same is true of our Mental Health Advisory Committee as well, because I think there are ramifications in our application of these different programs and services. Telemedicine and telehealth will never fully replace in-person care, and nor should it. But it is, particularly during the pandemic, showing us that there are a lot of pros to that work. So thank you all so much. We appreciate you. If you could turn your cameras off, and you are more than welcome to stay with us. throughout the rest of the presentations, but we will certainly understand if you have to drop off. The next three boards and commissions we will hear from are our Latino Health Initiative. And Monica Escalante, I think, just joined us, but Dr. Michelle LaRue is here as well. And so I'm not sure who will be presenting on behalf of the Latino Health Initiative, but you're both rock stars. And so we're happy that you're both here. I'll leave it up to you to decide that. And next, we also have the Interagency Commission on Homelessness. And I believe Alana Branda will be representing the Interagency Commission on Homelessness, and will be providing that testimony and answering questions this morning. And then finally, we have, our Commission on Health, and representing the Commission on Health today will be Mr. Chris Burt. So if all of you could, and you have turned your cameras on, I appreciate it. And so we will go in order, and I want to begin with our Latino Health Initiative, again in order, and just say a couple things up front. Our minority health initiatives and programs, I have always admired their work, but it has never been more important than right now. Our minority communities have been so starkly disproportionately impacted by the pandemic that it's truly tragic. And I really want to, and Councilmember Glass mentioned this earlier, which I greatly appreciate, my friend. I want to thank Councilmember Navarro, Councilmember Jawando, and Councilmember Rice, who each of us, through our own personal experiences and also the relationships we have within the community, have worked closely with the executive branch to stand up some initiatives that I think are having a dramatic and positive impact on the crisis. And but our work on some level, we set the table, but the work of the Latino Health Initiative, and we will hear from our African American Health Program later, who is also doing absolutely outstanding work, has been nothing short of heroic. The level of coordination that has been put together and the systemic approach to addressing the gaps that have been identified is a model that I know has to outlive beyond the pandemic. And so I really, I don't want to steal your thunder. It's probably in your testimony, but I just want to be on the record of acknowledging that incredibly hard work and just expressing my appreciation, and I know my colleagues will as well, for the really impressive level of work that's gone into this and the strategies. So with that, I'll turn it over to my friends in the Latino Health Initiative to have their testimony heard. And Monica, we are having each of the three presentations from the three boards, and then we will come back at the end to ask questions of all three at the same time. So we will be silent first, but we'll come back. So Monica and Dr. LaRue, please, the floor is yours.
And I'm going to turn to Dr. LaRue. I hope her internet is working well. I'm here to support her. Great.
Thank you. Dr. LaRue.
Yes. Thank you, Monica. I apologize with the hurricanes. We're having some connectivity issues here where I'm at. On behalf of the Latino Health Steering Committee, I want to say thank you to Council Members Albornoz, Glass, and Rice for this opportunity to speak. The LHSC, we are an independent group of volunteer professionals and community leaders who advise provide technical assistance to the Latino Health Initiative and to the county overall. We wanted to bring up two priorities specifically for this year. One is to maintain the supports to curtail the impact of COVID-19 on our community. As you know, COVID-19 pandemic has been devastating and unprecedented impacts on the health, the social, economic, and overall well-being of the community at large. Due to a range of factors, our community, the Latino community, has been disproportionately affected by high rates of infections, as well as hospitalizations and deaths. The economic impacts have also been devastating for thousands of our residents, including increasing need in food and financial assistance, healthcare services, and beyond. So we applaud the programs that the county has stood up to address these issues, allocating resources and support programs to support our families throughout these struggles, with specific emphasis on the EARP program, the rental assistance programs, and a slew of other social programs that have really been a lifeline for our community throughout. Many of our community members have gone without these support services due to eligibility for many years, and now with these levels, we applaud the county for supporting our residents. We are grateful for the allocation of specific programs like supporting the Por Nuestra Salud program. We know that the pandemic sadly isn't going anywhere anytime soon, so we urge that this comprehensive wraparound program that has been able to support both culturally and linguistically our community with outreach, with communications, with testing, with case management and food assistance programs is able to continue throughout this current fiscal year, and really being that lifeline that so many of our community members have needed to be able to stay afloat throughout this pandemic. We urge that the county continues to support our community and support this initiative, including also these county programs that I just mentioned, and contact tracing and testing, and as has been mentioned already, the flu vaccines and other vaccines hopefully coming down the pike soon. We also urge to be able to build more public trust, that we have sufficient data coming out too of where we are with this pandemic, being shared with the public on a regular basis. We are in dire need for data to be stratified by age, by race, by ethnicity, by zip codes as well, and even per capita, and rates of testing, positivity rates, hospitalization rates, and mortality rates, to really be able to assess where we are within our community. We also want to, as our second priority, want to address the need for a number of Latinos serving in decision-making levels of positions within the Health and Human Services Department and other county agencies. Proportional representation of Latinos at all levels of the county's workforce continues to be a significant problem that hinders the county in its ability to develop and deliver culturally competent programs and services that respond to the entire community's needs. Without constituents' diverse backgrounds being reflected in the composition of the decision-making bodies, the decision-making process is unnecessarily handicapped. Programs and services are short-sighted and may be ill-conceived, resulting in community members not assessing critical services while also limiting the Latino community's ability to fully integrate themselves into the fabric of the county life. These disastrous outcomes have further magnified during COVID, and trust needs to be rebuilt with the community that was hardest hit in these past months. Having highly qualified Latinos who understand our community within the highest levels of the county government is essential for the development and execution of sound policies and strategies aimed at achieving social justice, inclusion, and equity. So especially as we're still in the middle of this pandemic, we know that there are further steps coming down the line, like designing a COVID vaccine plan. There's never any time to lose in making sure that these priorities are taken into consideration. Thank you, Council Member.
Thank you very much, Dr. LaRue. We'll come to questions in a little bit. Next, we're going to hear from Ms. Alana Brand from the Interagency Commission on Homelessness.
Good morning. I'm Alana Branda with HHS. I am here on behalf of our chair and co-chair for the ICH, who unfortunately couldn't be here today, Jeff Goldblum and Ebony Johnson. And I do want to acknowledge a commissioner, Councilmember Glass, one of our commissioners on the ICH also. So as I know we've talked about in other forums, but our homeless continuum was extremely hard hit by the pandemic, as most of our communities have been. And, the pandemic has really exacerbated the struggles of those experiencing homelessness. Their complicated by the disparities in housing, eviction rates, and health outcomes. We have really struggled at this point. And so our recommendations and our testimony here is focused on the idea that at the core, housing is healthcare, and that our ability to provide housing is our way to end homelessness and is the best thing that we can do during this public health pandemic to provide safety and security for individuals, households, families experiencing homelessness. So I'll give a brief overview of what our top priorities, and I know you have the more detailed version in your packet. So what we're really looking to focus on is long-term housing subsidies. There is just an extreme disconnect between income and rent prices in our community here, and so we really need to provide more long-term housing subsidies for individuals. So we can do that by trying to get more housing choice vouchers. We are coordinating with HOC to submit an application for additional vouchers and to develop a prioritization system for individuals coming from the homeless continuum. We are proposing changes to the rental assistance program to better target individuals who have limited income and to increase the ratio of that benefit to more align. When the program was started, it was intended to be 25% of fair market rent you could get in your monthly rental subsidy. And unfortunately, it's been capped, though, at 200 for a really long time. So we are working to try to increase that. And we know that you guys took the first step in making code modifications back in July in the process of doing that. Also, again, coordinating with HOC about their rent supplement program, which is also a shallow subsidy program of up to $600 a month, to do more connected referrals through our coordinated entry system to utilize that as a method to exit people from homelessness. We also want to focus on barriers to accessing housing. We have a lot of individuals who are still unfortunately denied housing because of past criminal or credit issues. And so looking at ban the box legislation for rental properties, a lot of people also lose their housing because their landlord can just say, I want you out and I'm done. We don't have any just cause eviction legislation, which does need to be done on the state level. So we are coordinating with our partners on that level. Working with HOC to modify their background check criteria to try to loosen that up a little bit. And then the third priority that we have is really looking at how we can develop some extremely deeply affordable permanent housing in the county. Looking at the style of micro units, we know there's many people who what they can afford is only going to ever be $200 to $400 a month, and we need to be able to provide housing at that extremely, extremely affordable level. So those are our top priorities that we are focusing on as our way to long-term recovery from this public health pandemic. Thank you very much.
Thank you. Next, we're going to hear from Mr. Chris Burt from our Commission on Health.
Thank you, Chairman Albanese and Councilman Glass and Rice, for the opportunity to share our current fiscal year priorities for the Commission on Health. My name is Chris Burt, an epidemiologist here in Montgomery County and the current Vice Chair of the Commission on Health. The Commission on Health was established over 22 years ago and is comprised of 19 voting members with representation from consumers and providers of healthcare services here in our beloved Montgomery County. The Commission is focused on 4 public health priorities: school health, public health data and modernization, communicable disease, and racial equity. We plan to coordinate and align these efforts with our fellow boards, committees, and commissions that have identified the same or similar priorities. Together, we believe we can address the following public health priorities. School health. Studies have shown that poor health can put education at risk. Children with poor health tend to have higher absenteeism rates, lower academic concentration, and a higher risk of learning disabilities. Conversely, education can create opportunities for better health. Adults with a good education tend to have better jobs, access to health care, live in healthier neighborhoods, and live longer, productive lives. We are significantly concerned with the impact of the COVID-19 pandemic on student learning, In fiscal year 21, our focus will be on supporting efforts to ensure a safe return to the classroom. This will include identifying ways to ensure all school-age children are current on their vaccinations and providing recommendations on vaccine distribution plans. Public health and data and modernization. Modernizing the public health approach by integration of newer technologies to improve processes and the county's ability to respond to public health efforts is critical to addressing health equity. The recent pandemic has reinforced that there needs to be continued focus on updating systems to improve electronic record standards. Additionally, leveraging new technologies will help ensure efficient and effective data collection, processing, and reporting. In FY21, the Commission on Health will continue to advocate for the county to invest in building its epidemiological capacity as state-of-the-art data collection and analysis capability, which is an integral part to support the health needs of the county's residents. Communicable disease. The COVID-19 pandemic has brought the burden of communicable disease to the forefront. While we all can benefit from routine immunizations, reducing cultural, language, and other barriers to recommend vaccinations is essential to promote equity. The county also continues to bear the burden of other infectious diseases such as sexually transmitted infections and tuberculosis. A closer examination of the epidemiological data shows a number of conditions with increasing trends and demonstrating disparities by race, ethnicity, age, sex, and geographical data. In FY21, we plan to review this data and advise public health planning to better target efforts and resources to meet the evolving needs of a changing population here in Montgomery County. We hope to continue to encourage focus on science-based approaches to preventing communicable disease, with specific attention on routine influenza vaccinations for everyone over 6 months of age. We also plan to continue to work to help counter misinformation that would reduce the willingness of county residents to receive recommended vaccinations, including one for COVID-19. Racial equity is also a concern of ours. The Commission on Health is dedicated to identifying and addressing and correcting racial disparities in Montgomery County. We stand beside each and every Montgomery County resident, employee, and visitor in the quest to make Montgomery County a safe and supportive environment for everyone, regardless of their race or ethnicity. Residents of color, regardless of income, lag in access to health care and high-quality education. This year, the Commission on Health plans to ensure that racial disparities are addressed in all the priorities we have identified. We are committed to advising the county executive and the county council on racial equity, social justice, and inclusion throughout the county's public health issues, programs, services, and to monitor and assess racial and equity needs of the residents in this county. I greatly appreciate the opportunity to share our top priorities and will be happy to answer any follow-up questions the council may have. We look forward to working with our government leaders such as yourselves, community organizations, and the community as a whole as we work together to continue to enrich the health of the residents here in our beloved Montgomery County. Thank you.
Thank you, Mr. Burt. I have questions. I'm going to actually ask Councilmember Glass to ask the first round of questions for this group, though. So, and I'll follow up, and then Councilmember Rice, I know, has questions and thoughts as well. Councilmember Glass.
Sure. Thank you very much, Mr. Chair. Thank you all for your thoughtful testimony. Again, it speaks to, you speak to the intersectionality of all of our work because everything that you all said aligns importantly and beautifully with each other and the work that we are trying to do here at the council and in the county. Dr. LaRue and Ms. Escalante, thank you for everything that you're doing with the Latino Health Initiative and all of the work that you've done to inform the council and help guide our work and focusing some of the appropriation that we have provided under the leadership of Chair Albornoz and Councilmember Navarro and the hubs that we've put up. You said it all. And I have visited a number of those sites and community organizations and see the important work that you were doing. I don't have any questions for you, but I just want to say thank you. And as you continue having your ears to the ground, please do continue sharing that information with us so that we can do everything necessary It is incredibly important. And the data that you spoke of, we know it's true here, clearly, and it's unfortunately true nationally as well. We all read about these disparities, and the fact that we are able to do something about it in such a proactive manner because of the board, the health initiative like yours, and all of the boards and commissions that are here today and were with us yesterday. That is our social safety net, right? Everyone here holding hands together, working towards the common goal. And so again, just thank you for everything that you continue to do and will continue to do to inform us. In that same vein, Mr. Burt and the Commission on Health, again, we're talking about data-driven, a data-driven mission. And it is that information that informs everything that we do. Again, the intersectionality of all of it. For so many of you, we could swap testimony and you'd still be saying the same thing, because that is who we are here in Montgomery County. We want to provide health for those who need it in the communities where we know is lacking. I also appreciate, Mr. Burt, the focus on the public health data and the modernization. And if memory serves me correct, I've only had 2 cups of coffee this morning, but if memory serves me correct, I think we here on HHS had a very lengthy discussion last budget cycle just about making sure that our healthcare operations and the nonprofits and DHHS itself had the technological capacity to do this work and keep track of everybody so we could do the follow-up. I'm going to ask Ms. Yao to add that to our list, and the chair as well, to see if we can circle back. I don't quite recall where we left off in that conversation, but I know that we did recognize there were some deficiencies. And so again, I thank you for bringing that point back up. And then finally, Ms. Branda and the Interagency Commission on Homelessness, of which I'm a member, thank you. Thank you for everything that you all have done and the work that you all did over the last year, basically 2 years, to come up with a policy framework to update and modernize the work that you all are doing so that we in the county can expand the scope of work and mission to provide more services to families so that they do not become homeless. And that expansion is mostly women with children, which is why we, the HHS committee, as a whole, introduced the enabling legislation for you all to expand your scope of work so that we can tap into more HUD funding and other avenues of funding so that we can just provide more resources to women and children, because you all and our predecessors here, namely George Leventhal and former County Executive Ike Leggett, did incredible work being our program so that we have a nationally leading homeless reduction program here in Montgomery County. So again, thank you to you and to the co-chairs, Mr. Goldman and Ms. Johnson as well. It's a pleasure working with all of them and with you to fulfill this mission. And now more than ever, we need to keep people housed. We need to keep a roof over their heads because it is a matter of life and death. And the work that you and the Services to End and Prevent Homelessness have been doing, making sure that we get the rental vouchers out, that we get people signed up for the more than $20 million in CARES funding that the county has allocated to end and prevent homelessness during this health and economic crisis is critically important. So please extend my sincere gratitude and thanks to all the members of the ICH. And with that, I yield back, Mr. Chair.
Thank you, Councilmember Glass. I have questions. I'm going to defer to my colleagues to go first this time, though. So, Councilmember Rice, you're next.
Well, thank you very much, Mr. Chair, and thank you to all of you for your continued efforts. I'm going to start with the Latino Health Initiative because I just couldn't be more proud of the work that all of our minority health initiatives have been doing during this pandemic, and that goes for LHI as well as AAHP and AAHI. You guys have been amazing. and really highlighting for us what we are missing before the pandemic, but then also during this pandemic, and how we need to make sure that we're addressing those individuals who we know are oftentimes disconnected, marginalized in our community. And that goes for ICH the same way. So for me, it really is just about understanding. And so my question really applies to all three of you. So we can start with LHI and then go to ICH and then health, because for me, the challenge is that I fear once the pandemic is over and we have a vaccine, that folks will forget about the continued disparities that continue to exist when it comes to our communities of color, our communities of lower socioeconomic status, and their access to high quality health, and what that means for us, and what plans are we making to ensure that the momentum that we've achieved at this point sticks with us and doesn't subside when the COVID crisis is over.
May I take that first?
Please.
So the response to COVID with Salud y Bienestar, for instance, has brought so many organizations together and has built an infrastructure that would be a shame to let collapse after this. We've built trusted channels of communications that go directly into the community with the Promotoras de Salud and with all the other community centers that are participating. We have a channel to work on the distribution of the vaccine. We hope to be invited at the table when the planning stage is starting so that we can bring this know-how. And the hope, I love this question that you're asking, Councilmember Rice, because we don't want to let go of this infrastructure, this investment that we already made in the COVID response. We want to capitalize on it and build on it and do more with it. And the sort of very first stage might be the vaccinations. But then, as Mr. Bart said, there are a lot of other vaccinations that are behind and other things that we should be doing healthcare-wise to address these disparities. And I think this infrastructure that we have is by no means enough, but it's a good start and we could build on it more. Dr. LaRue, do you want to add some more?
Yeah, no, I just want to basically reiterate what Monica was saying and what others have said a little bit already. We do have, I agree. I think this is a super successful public-private partnership that really needs to be institutionalized and seen in a long-term, with a long-term lens. And it's very much adaptable. I think right now we're working with the challenge of COVID-19. But as Monica said, we can then shift gears to the vaccines that we're running behind on. Also, as Councilmember Albornoz mentioned, what the pandemic has done is exacerbate issues that our community was already dealing with prior to the pandemic. And so there's still going to be needs to be addressed. There's still going to be public health campaigns that are going to need that outreach support. Case management is going to continue. The clinical features may shift, whether it's a flu vaccine campaign or a COVID-19 vaccine campaign or some other clinical campaign, but we know that access to healthcare is also a great issue for our community. It's been quite a part of contributing to the disparities that our community faces every day. So I wholeheartedly agree with what's been saying that this is a great initiative that has been built, and we should see about making this more of a long-term institutionalized public-private partnership.
Ms. Branda?
Thank you. So agree with a lot of what Dr. LaRue was saying. I mean, homelessness was a crisis before, and it will continue to be a crisis after. And I think some of where we are working to continue to build off some of the momentum and attention that we are getting now is, first of all, we did adopt our strategic plan to end homelessness in November of 2019. And the number one strategy was addressing the racial disparities that are in our continuum. It is overrepresented by Black males specifically compared to the population, and we need to get to the root of to this and work to address those issues. I think the other thing that you can see from some of the recommendations today that we're really trying to focus on is some of the things that can be legislated or really codified. Right? How do we build off the momentum now to codify some of these things that are going to put us on the trajectory to really be able to continue to maintain that momentum and work to end homelessness in Montgomery County?
Thank you. And of course, last but not least, Mr. Byrd.
Thank you, sir. Well, it comes down to, a lot of discussions that, or testimonies that my colleagues here have given. A lot of it is circled around access. And what I would implore to you as a council or governing body is to, if residents are concerned or staying locked in, then we need to basically take the message out to them. I was just talking with a colleague a couple of days ago. It's like, they would say, what would a vaccination or a COVID vaccination look like, a scenario? Well, we have mobile testing. Why couldn't we do mobile vaccination sites, such as at a metro center, such as a shopping center, what have you? I think it comes down to taking the message, bringing the message to the people, whether it be in the field, whether it be through the use of technology, what have you. But we have the mechanisms in place. We just have to fine tune them, if you will.
Well, thank you very much. And I really appreciate that, because I think that overall, when we look at what it is that we are doing well, and then what we need to continue to do, it's very clear that we found ourselves in a new position in responding to a lot of the crises that we're facing. And we should never turn back from the progress that we've made. And that's what I've heard all of you say. I think that we need to continue to push forward. And then, Mr. Byrd, I certainly heard you loud and clear when it comes to school health. Again, that is all in the Kerwin bill. And so I really hope that we continue to push full force. I mean, the only reason why I keep mentioning this, I spent 3 years. This was a labor of love of trying to make this happen. And there are a lot of great recommendations that are in there that are exactly what all of you are espousing. And that only comes about if we can get this veto overridden. So thank you for your efforts there when it comes to school health. We really appreciate it. Thank you, Mr. Chair. I yield back.
Thank you, Councilmember Rice. A few thoughts. So want to connect two dots, and Councilmember Glass alluded to some of this in his questions, but on data analysis and access, we heard directly from Dr. LaRue, and then we heard from Mr. Burt. They didn't coordinate, I promise everyone who's watching at home, and we've heard that as well. And I know we do epidemiological work, and I got that right, got all the syllables in, nailed it. And so I think we should have a follow-up session on that, Ms. Yao, because the data collection and analysis, I know that we have talked about that previously, but it would be helpful to have a session and see how we are collecting that data and how we can provide greater infrastructure to Dr. Gales and his team, because in some ways, we're flying blind in certain areas, and we need to give the resources necessary for us to be more strategic and move forward the precious few resources we do have. I want to give a big shout out to Ms. Branda, who was my host when we did the nighttime count of homelessness. We were in a car together until 3:30 in the morning on a freezing cold night in the Shady Grove area of Montgomery County. And I was just so impressed, Alana, with you and your team and the incredible organizations that are out there fighting against homelessness. I know that this issue is depressing and frustrating for so many in our community, but I want to urge everyone that's watching that there is tremendous work in case management and evaluation that's being conducted. We need to expand it, and then to connect another dot from the previous session and on behavioral health and the mobile crisis unit, which has a direct impact on homelessness. And so there does need to be a greater infrastructure there, but we have to build on the successes. And I know that as the commission, one of the priorities, or I think the biggest priority, is expansion to homeless services for families, and in particular women who are in some cases fleeing domestic violence. And as we found out early on into my work on the council, and my colleague Beth Schumann was addressing the issues, the complex needs of a woman who was undocumented, didn't even know she was undocumented. I mean, it was a complex issue, but there were so few places for us to place her and her 3 children. And so that does need to be a priority. And Councilmember Rice has mentioned that repeatedly as well. And so that is something that has to be a focus, and we should circle back on too, and make a priority. You know, there are some opportunities and silver linings, and I mentioned this in another context, but you know, there are commercial properties that are starting to become available. And so we need to look at hotels that, unfortunately, right now, because of the pandemic and the economic crisis of our hospitality industry, you know, we should be looking aggressively at purchasing properties that we may be able to utilize for future services and work. So more to do there. And I want to end where I began in my opening comments with the Latino Health Initiative, and hear you loud and clear. Could not agree more. This has to continue, and this has to not just be a stand-up, standalone, but it has to become an institution, an appendage to the Department of Health and Human Services, because it so demonstrates when you have that level of coordination between the community-based organizations and providers working collaboratively with HHS, it significantly expands our reach as a community. And helps tighten that social safety net that has been challenged in ways that are hard to imagine, none the least of which because of our current president, who has just spewed hate and created this unbelievable fear that is real and raw and impacting all of us in so many different ways. I have had conversations with our chief administrative officer of the county about the need to not wait to see if we receive more federal funding. We have to continue this program, and I know all of my colleagues agree. We'll hear later from our African American Health Program that also must continue to proceed through this transition and be something that's codified moving forward. I just have one question. This can apply to all 3 of you as well, but you know, we have heard this. And we talked about this yesterday as well during our session, but not only am I concerned deeply about the mental health and the overwhelming feeling of our clients and patients and residents in the county, I'm also concerned about our providers because we know that people are burning out, they're exhausted, the wave of need is increasing, and now this next surge. What steps are each of you taking, or do you know of within your respective organizations to help ensure that the mental health and wellness of the staff on the front line are being addressed? And what more do you suggest we do or look at to help address those needs? And I'll start with the Latino Health Initiative.
So the mental health is a huge priority for us. You know, all of the staff working on the Salud y Bienestar effort have been trained on mental health issues to support the families, and they are experiencing that the pace that we've been keeping, it's really too fast, too much, and people are stretched too thin. So we are thinking about this. We are looking at perhaps changing the pace a little bit, slowing down a little bit next year. But also, you know, the next year is going to present other challenges because some of the testing, it's going to be really cold, and you can't do the testing sites the way we did this time around. So we may have to have mobile units, and sort of it's a lot of stress even in shifting the ways that we are delivering the services. But we don't have an answer. I mean, maybe Dr. LaRue, you can speak. We are talking about this intensively, and the new proposal will come up with some alternatives for us. That's a huge concern, though, and it's a priority that we share with the Asian American Initiative across the board. That mental health in general is a big concern for all of us. Dr. LaRue.
Yes, thank you for bringing up this critical piece to the COVID response. Definitely, I think, both our community is feeling it and needs very urgently mental health support, and really needs cultural, linguistic, and economically appropriate mental health, because those are usually the biggest barriers to accessing that piece. But also, of course, internally in all of our organizations, as we're also dealing with the fatigue of dealing with COVID response internally, but then also serving the community every day, hearing the stories from the community also is quite draining. And so we do, as Monica mentioned, as part of this program, we've done mental health trainings for the staff involved in this program. And we continue to talk about mental health in our individual internal meetings, as well as trying to bring in experts to the different institutions to help support the mental health piece within our organizations to be able to still continue to serve our community.
And I think it's only fair to mention that the Latino Health Initiative staff are also working incredibly hard, and this is part of the county staff, and perhaps everybody at the county level are also burnt out. So I don't know. Just want to recognize that everybody's working very, very hard.
Thank you. Ms. Brando?
Yeah, echoing everything that they said, I mean, at all levels, everyone is working really hard, and we are doing our best to try to promote self-care. I know different of our providers have looked at it in different ways. We have ones that are doing virtual dance parties with staff, delivering donuts, because we, of course, have all the shelters still open. So just trying to do little things. There was actually a group of Seth's staff who went on a socially distanced hike together to just, get out. So, and in-house also encouraging people to utilize the sources from Live Well, the program the county has in doing a lot of just, take a moment, take a breather. We do have, for our residents also, we do have mental health services and groups that are still provided at our shelter facilities, and maintain our partnerships with our mental health providers. But exactly as they were saying, it's challenging. I don't think, people thought we were going to go on a sprint, and as I've mentioned to someone, people say, oh, we're on a marathon now, and I think we're doing like the triple Ironman, right? Like, we just didn't realize you couldn't have trained for this in any way. And so we are just continuing to try to encourage self-care and make sure any resources that we have available are extended both in-house and also to all the providers.
Thank you. Mr. Bird?
Yeah, I would concur with my colleagues here, but also too, I would take it a step further. A lot of times we tend to we try to assume what they need. I think it's time that we have a frank discussion with our chief nursing officers, our medical directors at our various facilities, the Medical Society of Montgomery County, what have you, and in essence have a town hall of sorts. We've always been focused on a town hall that is community based. Well, I think we need to have a town hall and from a provider perspective and hear what their needs are and drive that home. I think the one thing that providers, I'm sure that they feel is that we as a legislative body or a commission are not hearing them, and because they're so ingrained or so calibrated to caring for the sick or those in need, they tend to forget or forego their own self, or they feel that they don't have time or nobody's going to take time out to listen to them because they have a job to do. And I think this is really a time, probably a most opportune time to take time out and hear from them.
Okay, I triple starred that one. Great idea. Absolutely something that we can follow up and will follow up on That's one thing the council does very well is town halls. And I think that this one will have tremendous value and substance, and I would love to partner with all of you on it. And also, explore, as the former director of recreation, I know that, they've been doing some really creative programming. And if you Google home fitness right now, you'll get like 50 million different videos that come up. And I think that there's something that we can do a little bit more intentionally, but also just provide a space for people to talk about this, because it's a growing issue, and it's going to lead to burnout, and it's going to impact the quality of care that we're able to provide if we can't take care of ourselves. And that obviously has profound impacts on our community. So absolutely a follow-up, something else that we've heard across the board from other commissions. And that's another one, Ms. Yao, that we'll follow up on as well. So thank all of you so much for your testimony this morning. Tremendously impactful, very, very helpful. And again, if you could turn your cameras off, you're more than welcome to stay with us through the rest of the presentations. But if you need to drop off, we will understand that as well. So thank you again. The next groups that we are going to hear from are Dr. Nguyen from the Asian American Health Initiative, AAHI, Margaret Madsen from the Alcohol and Other Drug Abuse Advisory Council, and Ms. Jacqueline Williams from the African American Health Program. We will go in order as it appears on the list. Each of you will have, again, between 5 and 10 minutes to make some comments. And then after all three presentations are complete, we'll come back and ask questions of the entire group as a panel. So Dr. Nguyen, thank you, and the Asian American Health Initiative. I've had the chance to meet several times with you through the pandemic. I know that you are focused very much on so many different issues, including the mental health of our Asian American community, which has also, over the last 4 years, been impacted by the rhetoric and the toxicity that we're hearing at the national level. And so I appreciate your work. Dr. Nguyen, the floor is yours.
Thank you, Councilmember Albornoz, Councilmember Glass, Councilmember Rice, for giving me an opportunity to join you at the conversation today. My name is Nguyen. I am the current chair of the Asian American Health Initiative Steering Committee. And it is my pleasure to represent my colleague on the Steering Committee to share with you the AHI Fiscal Year 2021 policy priorities. As you have heard from other committees and council about the impact of the COVID-19 pandemic on the county resident, I will not go further on that, but I just want to reiterate that the Asian American community, as other ethnic minority community, also suffer badly by the pandemic. In some level, we doing slightly better. In some area, we really suffer a lot. I want to thank the staff on AAHI and also many partners from the NGOs and faith-based organizations who are working really hard to do a lot of listening and engaging with the community to help to understand where they need to come from and provide them the resource and support so that they can deal with the pandemic here. I'm happy to discuss in more detail about the need, but I think for this conversation today, I would like to share with you further on terms of what the policy priority and strategy need that AHI want to move forward. So the first thing that I want to share is about the blueprint that AHI have released in 2020. And at first, the Steering Committee would like to thank the Council for your support of this blueprint because it laid out the roadmap for AHI in the next decade on how we should prioritize and effectively support the Asian American on the diverse needs of our communities. As you know, Asian American is not one group, but we are very different in the type of need, the kind of challenge, and the kind of thing that we can do. So in order to support that need, it needs a very strategic as well as a diverse approach to support our community. And that document, the blueprint really allow us to tackle it in a strategic level. I want to highlight the 4 priorities that listed in the blueprint here. The first is a community engagement. The focus is to bring the awareness to the community, to educate and enhance access from the community to key resources offered by the nonprofit or by the county. The second priority is a community empowerment. The idea is how AHI can provide the technical assistance to help the community-based organization and faith-based organization with the necessary skill so that they can be more effective in serving and addressing the need of the community. So AHI as a county government office should not do the job of an NGO, but it should be an enabler to help the community organization to better address the need of the community. The third priority is capacity building. So AHI can help to develop models, tools to help the community organization and as well as others county government group department to assess and to support the Asian American community. And last but not least, to be a change catalyst. We envision that AHI as a liaison between the community and the HHS and the county government at large so that we can help to facilitate a conversation and dialogue between the community and the county government. So that really in 2021, the focus is on how we take the step to implement this blueprint strategy in the context of COVID. There's many things that we can do, and I'm glad to hear earlier from Councilmember Alvarez about how the holistic approach that we can take here, because it's not only community that need, but the provider and the community service organization. How can we look at this overall? So that leads into the second priority that we have in terms of health. The focus that we have for Asian American community is on health and wellness program. Again, taking the holistic approach on focus on prevention and develop a healthy lifestyle here. It sounds remotely related to the pandemic, but it's not, because what better time than this time to help people to understand the importance of being healthy, right? How should they take care of themselves? And based on that understanding, we can encourage them to take more responsible action in terms of wearing masks, say social distance. So those are the approach that we are taking with our community. And also we recognize the need for the Asian American community during this time, that it's not only the stress from the physical health, but the stress on mental health, the close of business, the stress on the financial health. How can we provide that support holistically to the community? So that's the second priority. And last but not least is I want to reemphasize on the importance of mental behavioral health and senior health. This has been the focus of the Asian American Health Initiative in the past 5 years. And during this time, we doubled down on it because the stress, the depression level that we observe from the Asian American community has increased significantly, and especially in our senior community, where they feel the social isolation, loneliness. So those parts that we continue to leverage the successful tool that AHI has built in the past in terms of the photo novel, in terms of the video and outreach tool, the relationship that AHI have done. So we continue to help to bring those information in a new way to our community so that they understand the importance of it, and they know that they can reach out to us if they need support. So thank you very much for your attention. I will stop here, and I'm looking forward to the discussion.
Thank you, Doctor. And next we're going to hear from Margaret Matson from our Alcohol and Other Drug Abuse Advisory Council.
Good morning. Can you all hear me?
Yes, we can.
Okay. I'm Dr. Margaret Mattson. I'm the current chairperson of the Alcohol and Other Drug Abuse Advisory Council, or AODAC. We're very grateful for this opportunity to present to the Council our priorities for FY 2021. So we thank Council members Albanese, Rice, and Glass. The first of our priorities focuses on prevention, which is needed at the current time. I'm sure you've all seen the reports showing that drug overdoses have increased during the COVID period and continue to. So one preventive activity that we are going to undertake is to accelerate our efforts to educate county residents on the consequences of substance misuse. I'll cite 3 examples to illustrate to you how we will accomplish the goal. The first example is a newly launched program to protect our youth from the social and behavioral risks due to isolation caused by COVID. Studies have shown that social isolation and loneliness are likely to contribute to depression and anxiety for children and adolescents.
Dr. Mattson, we are
being at home all day.
We're getting you're kind of breaking up a little bit, and we want to make sure we hear your crisp and beautiful testimony. And I see that it looks like you're logging in potentially from another device as well. Not sure if that's impacting it, but just want to make sure we get every word. So just to let you know, you're breaking up a little bit. I'm getting.
Yes, I noticed that.
But just
presentation. Is here? I'm hearing an echo.
Yeah, now we can hear you though.
And I can't. Yes, and I can't hear Councilman Albanese, so I don't think you can hear me, and I can't hear you.
We can hear you now, and you're actually much clearer. So I'm not sure what we did, but you're on. So please go ahead.
Oh, okay. Okay. Let me continue, and I'll just backtrack a moment. The first of our priorities for the upcoming fiscal year focuses on prevention. And this is very times that we're seeing in overdose rates. It continues to increase, and this is very alarming. So one of our efforts is to educate county residents on the consequences of substance misuse. And I'd like to cite 3 examples of how we plan to accomplish this. The first example is a newly launched program to protect our youth from the social and behavioral risks due to the isolation caused by COVID. Studies have shown that social isolation and loneliness are likely to contribute to depression and anxiety for children and adolescents. Being at home all day, often alone and unsupervised, may lead to increased vulnerability to several risks. These risks include greater access to drugs, alcohol, and tobacco, as well as to other environmental dangers such as unsecured weapons and unsupervised use of risky online sites. A virtual prevention education program to address these risks and increase the awareness of parents of these risks is now underway by AODAC through a collaboration with the Montgomery County Parent-Teacher Association and other partners such as Mothers Against Drunk Driving. This virtual education program has been disseminated by the Montgomery County PTA, and so far this school year has reached over 12,000 county households. The second example of carrying out our prevention and education priority is now under development. We're planning a mini-series of 4 presentations aimed at educating the general public on substance use. It will address topics such as the addiction cycle, stigma, racial and cultural inequalities, comorbidity, the importance of early intervention and prevention, and treatment models and delivery systems. The final example is to increase the value of the AODAC website to bring timely educational material on substance misuse to county residents, now during COVID and for the future. We're working on ways to enhance the content, audience reach, and format of our website. Our second priority area for the upcoming fiscal year is to advocate for legislation related to substance use prevention, treatment, and public policy, which is so important for the county's ability to support evidence-based interventions, both prevention and treatment. During the last few years, AODAC has tracked and reviewed pending legislation at the state and local levels. We hold a yearly legislative retreat where we identify several bills of highest priority, and members prepare written and oral testimony to advocate for or against these bills. And we intend to continue that for this year. Finally, in addition to the two top priorities I just described, we're continuing to work with partnership development with other BCCs and outside organizations, particularly around topics such as suicide prevention and vaping among our youth. Thank you very much.
Thank you very much, and we heard your testimony clearly there, so it was fixed. So thank you so much.
Thank you.
And next, we are going to hear from Ms. Jacqueline Williams from our African American Health Program.
Thank you so much, Chairman Albanese, Craig Rice, and Evan Glass. Thank you so much for this opportunity to speak with you. I hope you hear me. My computer has gone down twice. I had to reboot and come back in a couple of times. So hopefully things will be stable for my presentation. I'm Jacqueline Williams from the African American Health Program. I am one of the co-chairs of the African American Health Executive Committee. We are the board for the AHP. We're grateful and thankful to receive funding for our COVID initiative, which is the AHP COVID Response Project. And we actually have been really starting from ground zero, basically developing a infrastructure for COVID response for the Black community, which of course our community includes African American, Caribbean, and
Ms. Williams, if you could hold on one second. If everybody who is not speaking could mute your phones, or if the staff could mute everyone else's phone who's not speaking, because we're hearing a little bit of an echo. We can hear you, but we want to hear you even more clearly than we are. So thank you. Ms. Williams, please proceed.
Thank you. And of course, Africans from the diaspora. We've had a really robust response from our community, kind of a public-private partnership that's been developed to respond to COVID in particular. The enthusiasm is off the chart. It's fantastic. Everyone wants to pitch in and help. As you know, Black population is the population that is dying from COVID at the highest rate, sadly. And it's due to primarily underlying conditions that we've been talking about for years in terms of disparities. Our underlying conditions that are chronic conditions that we've dealt with for years, hypertension, chronic lung disease, asthma, diabetes, kidney disease, and others. These are long-standing conditions within our community, and these certainly are exacerbated with the COVID outbreak. And we're not surprised that looking at the data that the zip codes that we have been talking about for years, the geographic hotspots, they're the same ones that unfortunately affect the Black community. These are in East County, in Gaithersburg, Lower Silver Spring, where there are concentrations of African Americans and Blacks within the county where they reside. And that's where the highest death rate seems to be occurring among the Black population, unfortunately. And there's a growing concern that our seniors who seem to be disconnected from their social work networks now, even more isolated than ever, especially with the need to quarantine away from their family because of their age and so forth, and so unable to perform their normal duties and so forth. The other issue that there's our African Americans and our Black population is a keen and deep distrust of the healthcare system for a number of reasons. This is deeply embedded, and so to dispel some of the notions about access to healthcare, we're working on our education campaign to work on that aspect of dispelling their concerns and fears. We have opened up testing sites around the county to get our Black community tested, determine who is positive, who is not. And that's been quite successful. We're building that up, continuously building it up. And our approach is to go to where the people are. We're at the churches, we're at housing developments, we're trying to be where they are. So, because our Black folks are in pockets, basically, in the county. And not as easy to reach as you would think, but we've been able to gather momentum and get them to come out to get tested. Also, we have follow-up services for those who test positive. We provide food, door-to-door delivery of food, so they don't have to, if you're positive, don't have to go out to the grocery store and infect everybody else. You stay home, we'll take care of that for you. We also have nurses. These are registered nurses who do wellness checks on our positive clients, make sure that, nothing happens to them. They don't feel fatigued one day, and 24 hours later, they're dead. And that's unfortunately the kind of scenario that can happen. So we have our nurses providing wellness checks on them, We provide thermometers so that they can take their baseline temperatures, and then we can monitor that as well, because that's one of the factors in terms of COVID. We also have mental health services for counseling, and we're starting a domestic violence hotline as well for those who are kind of at home with their abusers. And that is a bit culturally competent for our Black community because there's such a reluctance to seek out services. So we're trying to do a number of things to encourage our community to get tested, and support them if they're positive. We also have a Black Physicians Network we're so excited about. I have to tell you, we're so excited. A number of people really want, our Black folks really want a Black physician. So we're building up that network as well. Now, we started out, of course, with those who are positive. These are physicians that will, accept positive patients. But we want to continue building that network so that those who, are positive or negative would be, who are interested can partake of a Black physician if they so desire. But we're very excited about what we're doing here, and we want to, we know this is not going to end this year, unfortunately. COVID is going to be around for a year or maybe more, the way things are going. But we are continuing our education efforts because we want people to continue to social distance, to make sure they wash their hands and they wear their masks, and that's a challenge for all of us to help people not end up with COVID fatigue. And I think that's where some of us are going now. With holidays, everybody wants to do what they've been doing before they can't. So we're trying to educate our population. As I said, a lot of distrust is deeply embedded, distrust of the medical system. And of course, one more thing about our mental health issues are Black males in particular. Because they're wearing a mask, people are distrustful of them because, they don't know what they should or shouldn't. And so educating them that it's okay, and how they can maneuver the system without being targeted is one of the other issues. So I appreciate all that the council has done to help us move this COVID response ahead. I can't tell you how much we feel that the council is with us on this issue, and it's an issue that's in the heart. We really, it's in our heart and soul, and we want to save the lives of our Black population. Thank you.
Ms. Williams, that was beautiful and powerful testimony. And yes, we are absolutely with you and all of our boards and commissions. I can't thank you enough for your dedication and leadership. I know Dr. Nguyen has to step off at 10:30, and so Dr. Nguyen, we'll follow up with you after this session with follow-up questions. So please feel free to step off whenever you need to, and we will, again, have a follow-up session with you to discuss any items we didn't get to today. But yeah, that was great testimony. Kicking us off,
I can stay for another 10 minutes. So
okay, perfect. Kicking us off on questions and Q&A, this round will be my colleague and friend, Councilmember Rice.
Well, thank you very much, Mr. Chair. And so I'm going to be quick so that I can make sure that all of my colleagues get a chance to ask Dr. Nguyen questions before he steps off. Dr. Nguyen, obviously, and you prioritize behavioral health. That has always been something since I started working with your organization that has been a primary concern. Obviously, as the chair said, exacerbated by what's happening with the president and many of his fellow colleagues in making our Asian Americans feel as though somehow they are at fault for this pandemic has just been such a tragic, tragic story. One in which, again, I can't imagine the stress level that's not only on the adults, but the children and what they have to deal with. And so please understand that we continue to be committed to making sure that we provide the resources that are necessary to give people some of that help when it comes to trying to reconcile the position that our current president has put us all in terms of really, making it seem as though our Asian American community is somehow at fault. So again, something that's very much a concern of mine. I know that as a part of that, the senior wellness piece, suicide rates, all of those things are things that I know that you guys work on all of the time. And so just recognize that we see the work that's being done, even with the pamphlet that you did with the cartoons that really make it personable. Those are things that we need to continue to do to really make sure that we're reaching out to the community. So thank you for that. When it comes to AODAC and Dr. Mattson, let me just say thank you again for what you're doing to prioritize. We know that when people deal with stress, so this is a perfect segue, when people deal with stress, they oftentimes self-medicate. It's unfortunate, but it is through sometimes alcohol or other drugs. And so we're concerned about that from our children, let alone our adults. And so what are we seeing? Have we done any surveys to try and see what kinds of increases may be there, especially with our young people, and because they're at home more, so there's more access to a lot of the things in their parent cabinets, their liquor cabinets, all those kinds of things. Have we seen any kind of rises in those kind of situations?
Well,
Ms. Matson, I think you put yourself on mute.
Yeah, we lost her.
No, here I am.
Okay, there you go.
Yes. Yes, there is certainly a great deal of anecdotal information on that. I think at the level of Montgomery County per se, I don't think we have data that is at that detailed of level. But we know from other situations and other kinds of studies that when young people, youth and adolescents are at home and unsupervised, this is the period, this is the ideal circumstances for them to have problematic access to things that they shouldn't. So I can't say that it is that trend has been exacerbated with COVID, but my best inference would be that it certainly has been a factor, and perhaps even an increased factor over what's normally seen when kids are isolated and unsupervised.
So, Mr. Chair, maybe we could do a follow-up to that. I really want to work with NCPS as well as with HHS and, of course, with AODAC to try and figure out if we can hone in on some of that to provide some additional supports. I do think that it's incredibly important, and we can work with MCPD and with our fire department in terms of looking at some of the numbers that we've seen in terms of calls of cases. And certainly that may help us to be able to glean some of that information. And then last but certainly not least, my good friends at the African American Health Program. Jackie, thank you so much. I am equally as proud of the great work that AAHP has done. I'm very excited about the rollout and going out to the testing. You know, it's really important, and I don't think it can be lost enough to understand how troubling it is as an African American man to hear folks say, well, COVID's not that bad. Because the unfortunate reality is that they're saying that because they don't see people like them who are dying or who are being hospitalized. We see it in our communities of color. We see it in our Latinx community, to where they have the highest number of cases. And we see it, as you said, in our African American community, to where we actually see the highest number of deaths. I just found out yesterday that my aunt, who lives in New Jersey, has contracted COVID. Many of you know that I keep talking about this and sharing my personal stories because it is important for people to understand you are not in isolation, and there are tons of people who are out there who are contracting this horrible disease. And so we have to make sure that we're letting people know how serious it is and how much more we need to do to educate our public and keep them safe. And so I really just want to say that your initiative that you're now focused on, that was, you know, spearheaded by you, but help funded by the council, is going to help to address some of that. And I just can't tell you how important that is right now, because as we see the numbers continue to rise, there is no question that those numbers that are rising are deaths that are in our Black community and cases that are in our Latinx community. I mean, it's not going to stray away from those numbers. And so I really want you to know that, as I've said for all of the folks who've been on this call to this point, you have our unfettered support. We know that this is not, as you said, Ms. Williams, this is not going away tomorrow. Even with a vaccine, we know about the challenges that our African American community faces when it comes to trust of a vaccination. That's why you will play a key role in terms of us rolling out a vaccination and making sure that that's given to our communities of color. You guys are going to play a key component in that, as well as with AHI and LHI. And then again, when it comes to treatment, again, like I said before, after this, there are still going to be those disparities that continue to exist. And so the good work that you've been doing pre-COVID will still have to be doubled down, and we still don't know. And this is what, I'm sorry, Mr. Chair, just one last thing. Dr. Gales has said repeatedly, and I've asked him about this, what are some of the long-term effects of coming down with COVID, but not dying from COVID, that we still need to be aware of? Well, let's just be real about it. If the number of cases that are happening are within our communities of color, then there's going to be even more health disparity that's going to exist with whatever these long-term effects of coming down with COVID and beating it are going to be. And we're going to have to treat that as well. So there's still a lot of work that's going to need to be done. And so I look forward to continuing to work with you. You've done a great job when it comes to everything from infant mortality to maternal health to all kinds of things, to diabetes, to high blood pressure. The list goes on, as with all of my minority health initiatives. And so we'll need to double down those efforts to continue into 2021. So thank you, Mr. Chair.
Well said, Councilmember Rice. I did have a couple comments. One, particularly while all the minority health initiatives are still on. So the council in August appropriated funds to help provide support for private medical practices, family medical practices that are really struggling financially, and disproportionately, a lot of our minority doctors were being impacted because oftentimes they're not affiliated with larger medical networks like Johns Hopkins and others. And so while private medical practice is still every bit as a part and an important part of our social safety net that goes beyond our incredible clinics who are doing great work. The RFP was just launched last week for those funds. And so I strongly encourage all of our minority health initiatives to please let your networks know about these funds that are available. It's up to $50,000 per practice. It includes, thanks to Councilmember Rice, dental practices as well. And so we're going to add $500,000 to that fund. And this has to be spent before the end of the year because it's CARES funding. And so it's important. It's a quick turnaround. But to the network that Ms. Williams was mentioning earlier, which is so critically important, this is going to be a lifeline for a lot of our medical practices. And the Medical Society has been a great partner here. But I think our minority health initiatives are going to play an important role. And then Dr. Nguyen, as I know you have to jump off, but if you could just speak briefly, and then Ms. Williams, I'm going to have questions for you as well. But since Mr. Nguyen has to jump off, I'm going to go with him first. In the two sessions I've had with our Asian American Health Initiative, and the blueprint is very well thought out and very well done. Are we continuing to see now those mental health, the reference to the China flu and those awful racist, derogatory comments made by the president? Are we still seeing an impact from those since the beginning of the pandemic? Is that a concern? And what can we do to help support and turn that around?
Sure. Thank you, Councilmember Albanos. For sure, the sensitivity of the message of what would the origin of the virus and how the virus get into the U.S. has been a tremendous pressure for the Asian American community because people look at us differently. People blame us in a different way. So it has been challenging for the Asian American community when we face the unspoken discrimination. Sometimes it's just a look, sometimes it's a scare that people give us. It's still there. It still exists within our community there when we experience. And I think Councilmember Rice mentioned that previously as well. It's not only for the adult, but for kids. A lot of times we don't know how they experience that from interaction with them in school there. Now even though things go virtual, but it's still there's a concern that they have there, and how to measure it. It's hard to know. I have to jump off soon, but I just want to reiterate one point that you mentioned here is the importance of collecting data, because I think that's a part that we experience from the minority community, and especially for Asian American community, we are under the impression as a model minority, and we don't have that much the need. So I think the data is critical to show that, because it's not even. Some communities, some Asian group do a bit better, some are not. And so we really will need to recognize it, and this can only be amplified by good data, and not only direct data, but also more like other factors. For example, a lot of Asian American own small businesses, and the pandemic affect them tremendously, and that cause stress and mental health issues. So those are something that we need to consider in our plan to address this issue.
Thank you, Dr. Nguyen. I know you have to step off. I appreciate those comments, so important. And I apologize, Mr. Glass, if you had questions for Mr. Nguyen, but we'll follow up on that as well. Ms. Williams, one of the concerns I have, in our community right now, the biggest spreader of the virus is family gatherings, and not getting our families together goes against every instinct and ounce of our DNA, particularly in our minority communities. And so it's so hard, particularly with Thanksgiving on the horizon, for us to encourage people to not get together. But it's hard on every conceivable level, but so important. How do you think, or how would you recommend, what are the best communication channels for us to get messages out like that, but others related to the pandemic? And I'm also so sensitive to and so appreciate you bringing up the issue of the masks, because it is a very raw and real issue, that disproportionately impacts our Black community in particular, with everything else going on in the world and this inflection point that we're in with regards to racial justice. But what are the, in your opinion, best channels to get the message out to our various communities?
Well, one of the things that actually we read my mind, we're working on some actually videos, holiday videos, we call them holiday videos, to talk to people about social gatherings, and that there are ways that we can communicate with our loved ones away from each other, and different methods or methodologies to communicate with them, through the Zoom, and actually have our marketing people coming up with some ideas. They actually have a meeting tomorrow on which method of messaging they want to use. And one of the things that I know was brought up was to have cook together via Zoom. And so they're coming up with some kind of creative kinds of activities like that. So you're at your house, I'm at my house, and we can, kind of work together and try to make our holiday meaningful for each other and family. So we're not together, but we are together.
Thank you. I appreciate that. And then finally, Dr. Mattson, thanks again for your hard work and dedication. I know that the issue of substance abuse, particularly now, and the isolation and the social and emotional issues, and as Councilmember Rice said, a lot of people self-medicating in a number of ways. And one of the industries that has exploded through the pandemic and is doing just fine is our alcohol industry, and that's true of county as well. So I guess in terms of messaging, similar question to Ms. Williams. How would you recommend, what tools should we use to get the word out to our families, particularly now when people are even more vulnerable than they normally are, on how to prevent or look for signs or different areas that all of us as a community can take into account to help prevent our friends, our neighbors, our family members, our colleagues from falling into this despair?
One of the things that we've seen seems to be effective is to model the behavior that you want to see. So if you want people to social distance or something like that, then you have some sort of, with your media channels, to model that behavior so that they can actually see it in action. It seems to be pretty effective because people don't seem to know what to do sometimes. There's certain situations, just common situations. Maybe they're just kind of walking through a building, there are other people coming in, people going out. How to model that? People are still trying to figure out what to do. So having those use your media, help people model. I think that gets the message across, also changes their behavior.
Thank you, Ms. Williams. Those are excellent points. Dr. Matson, what are your thoughts?
Yeah, I'd like to add to that. I think some of the best models that we have for the community is the recovering community. Those who have, suffered from an alcohol or a drug use disorder and are now in recovery. I think it's a group that we should take as much opportunity as we can to have them, publicly and through other channels of education and information, talk about their experience, talk about how they've recovered, and most importantly, it gives hope to those who are currently struggling with substance use disorders. I think there's nothing as effective as hearing someone else who has been there and has succeeded in recovering. So I think they're a very important resource for us to bring forward and to provide them with the kind of exposure that will set an example and provide hope for those in the community who are still suffering and struggling with these disorders.
Thank you, Dr. Matson, and I appreciate this panel. Councilmember Glass.
Thank you, Mr. Chair. You and Councilmember Rice did a brilliant job of raising the points and asking the questions that I had written down, and I did want to share my appreciation for the comments by Dr. Nguyen, particularly the continued use during his testimony of the word holistic, because ultimately that's the way we need to and hopefully are approaching all of these issues, looking at the root causes, trying to figure out how we at county government can work with our nonprofit NGO partners to provide the services and outreach and education across the board, regardless of the commissioner board that we're talking about or the community. And so I do want to follow up with him, particularly about his thoughts on how we are reaching out to the fast growing Asian American community here in Montgomery County and what we can do better with regards to engagement and healthcare opportunities. Switching gears over to Ms. Madsen, the chair just asked the question that I wanted to ask, which is about the record sales of alcohol and spirits and beer here in Montgomery County from our private vendors, but most notably from the Department of Alcohol and Beverage Services. I remember seeing a press release that they sent over the summer or late spring saying record sales. And that was when, the lockdown stay-at-home orders were in place. And so I appreciate the comments that you just shared about how we try to work within the communities, work within those who have work with substance abuse organizations, whether it is Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, however we can. And if you have any thoughts, additional thoughts about those partnerships or ways to do any additional outreach, I welcome them.
Yes, and that's something that we're interested in doing as well. We hope that we can make our website a much more prominent way for providing this kind of information to the community, and that's why it's one of our big prevention initiatives to really try to strengthen that channel of communication and to also make it a forum for other organizations, such as those you just mentioned, to incorporate their message into a county-based website. So that's one of our aims for the coming year.
Absolutely. Well, I think that is a good initiative to work under. And, you know, one of the fascinating things about the pandemic and about us transitioning to an all online platform is so have those organizations that I referred to. They are having online platforms. I have a number of friends, family members who participate in those conversations, and they're needed now more than ever.
Yes.
And I you know, happy to work with you to try and, you know, make some of those connections and help share with them the resources that we have here in county government, and let them know about your advisory council in particular, to see if people would like to use their energy and passion in that way. And so I'll follow up with you about that, because there are people who are seeking help, and they're doing it in all forms and fashions, and particularly on Zoom calls these days.
Thank you. We would be delighted to work closely with you on that.
Wonderful. Thank you for that. And then Ms. Williams, you know, Councilmember Rice during his comments took the words right out of my mouth, and I will quote him as I typically do. You have our unfettered support. You know, we know that here in Montgomery County, we are leading by the science and the data. And that is shaping our healthcare policies and our initiatives and directives. And we know that the science and data also show us that the African American community and our communities of color have been hardest hit. And so, again, you have our unfettered support, and so continue sharing with us and Councilmember Rice and Jawando in particular with their leadership towards the COVID response to the African American community. You know, let us know what more we can do and what you're hearing on the ground, so that it helps shape some of our public policy and funding priorities.
Oh, thank you so much. My internet is kind of unstable now, again, but I do appreciate all your support. Thank you.
Very good. Well, we appreciate all the work that you do, and this is again one of, you know, yesterday and today are two of my favorite days on the council, to hear directly about all the impactful work that our citizens and leaders and county staff are doing, and informing us as what we can do better, and helping us shape our agendas individually and collectively for the next year as we enter 2021. So again, thank you all for spending your morning with us.
Well, thank you, Councilmember Glass. Thank you, Councilmember Rice. This has been an unbelievably informative 2 mornings, and I want to thank you, Ms. Yao, and the staff for helping to coordinate these really impressive briefings. I want to thank from my team, Ms. Beth Schumann, who is our lead on HHS Matters and is a rock star, and I so appreciate her leadership as well. There is a lot to follow up on here, and, you know, while we were talking, just like breaking news, the University of Maryland Michigan State game has been canceled, and Coach Loxley has tested positive, the coach for Maryland. But I'll end on a high note. We did also receive word that the waiver we had requested regarding the child care issue has been granted by the governor. So that is a very positive step moving forward, and for a number of our child care facilities and centers, we will be able to continue as we have in phase 2, but with the same number of students, which is significant for so many of our families. So thank you all again. There will be several sessions as follow-ups and several items as follow-up as well. But I want to thank everybody again for their very thoughtful testimony. Dr. Santiago, normally we would turn to Dr. Crowell for some final words, but I think you are a representative from HHS this morning. So if you would like to say some words on behalf of HHS briefly, we'd appreciate it.
Sure. Thank you, Chairman Albornoz. It has been really inspirational to hear all of the testimony today. And I'm like all of you council members have remarked at the HHS and at Behavioral Health and Crisis Services, we lend your support wholeheartedly, and we're there for you. And just very briefly, I jotted down a couple of things that I heard, and some of the things that we're working very, very hard. The crisis model is one that is a hot topic for us. Councilmember Rice talked about working with students and youth. We're trying to make that a high priority. Chairman Albornoz, you mentioned the recruitment of people into these positions, and we talked about self-care of our own staff. And I can testify already that when you hire from the community, you're also going to listen to stories, just like Councilmember Rice was talking about. And I've heard stories already because our own staff are experiencing the effects of COVID-19 and of the pressures that their families have. And I'm trying personally to be sensitive and supportive of the staff. So I just want to commend all the groups here, the commissions, the boards. I'm looking forward to becoming more familiar with you, to be present with you, and to collaborate on tremendous work that all of you are doing. Thank you.
Thank you, Dr. Santiago. So I think that wraps things up. Ms. Yao, anything else?
No, we'll get to work on all the follow-up items.
Great. Well, thank you all again. Everybody stay safe. Have a wonderful Thanksgiving holiday season. You look great, Craig, and we are adjourned. Thanks, everyone.
Is it okay to still say Happy New Year?
I guess so. I mean, I've told folks in the Chinese community that they celebrate